All I ever do in the mornings is drink my tea and smoke my vape.
Pitched by some as the best way to stop smoking.
Vapes are the most effective quitting aid we've got for adult smokers, and they should be available.
Vapes have now overtaken cigarettes as one of the biggest health crises of our time.
They are like crack, those things. I'm way more addicted to vaping than I ever was smoking.
We're definitely hearing that children and adolescents are vaping in higher numbers, and the marketing is definitely playing into it. They've got cartoons on product packaging. They're available in USB-like devices.
Now the Therapeutic Goods Administration has a plan to tackle it, advising the government to implement a raft of measures designed to get young people off the vapes. The big ones: warning labels, plain packaging, the introduction of import permits to crack down on bootleggers, and a total ban on flavoured e-cigarettes.
These reinforce the addictive nature of nicotine. They have no value for smoking cessation, and they are only really being used to market to youth and to get them hooked on nicotine.
The TGA also wants a crackdown on the illegal sale of nicotine vapes, which are currently available under the counter at most tobacconists.
Adolescents are saying it's very easy to be able to source these products. So this is why we're really concerned about the consumer model, because we know that these retailers are already selling to young kids illegally.
Everyone can have access to them nowadays, even if you're underage.
I know that some of the places in here just import them from random places. You don't even know what you're really ingesting or smoking.
And our under-12s are the latest to fall victim to the candy-coloured, deliciously flavoured smoke sticks.
This is now the biggest behavioural issue in primary schools.
In Victoria alone, the health hotline reports 50 under-4s have suffered vape poisoning. And just this month, a New South Wales mum filmed her 1-year-old inhaling an e-cigarette. So far, state and federal governments are yet to commit to taking the TGA's advice. So can Australia turn the toxic trend around? Or has that horse already bolted?
I got off them when I started receiving really bad headaches from them.
I've seen people go through addictions and that. It's really hard to get off of it.
Dr. Anthea Rhodes is a paediatrician at the Royal Children's Hospital in Melbourne. She joins us now. Doctor, what are you seeing? Are more young people vaping?
Unfortunately, more and more young people are taking up vaping. Certainly in my own clinical practice, I've seen children as young as 8 or 9 who are regularly vaping. And we know from other information like the Victorian Poisons Information Centre that we've had children under 4, in fact 134 children under 4 who were exposed to vaping products just last year.
How would that present itself in terms of health effects and health problems?
So for older children and particularly teens who might be having issues with addiction, the sort of symptoms that we would see are irritability, difficulties with sleep, difficulties with mood and concentration. So lots of things that can be really hard for parents to tell the difference between what might be typical teen behaviour and what might be something more worrying. There's also symptoms that might relate to breathing. So sore throat, cough, irritability have been shown now to be linked to vaping, and we certainly see this in young people.
Doc, how on earth does an 8-year-old get their hands on a vape?
Lots of ways, unfortunately. So often from older siblings, teenagers. It can be, in some instances, children are stealing them from parents. Many adults might recall the idea of nicking perhaps a tobacco-based cigarette from a parent back in the day. That sort of thing actually goes on now for children when it comes to e-cigarettes and vaping products. So where parents have them in the home, being aware that their children might be getting hold of them is really important.
If the TGA's advice was implemented, would that be enough to wipe out vaping?
I certainly think it would be a beginning. I would not go so far to say that we could guarantee it would wipe out vaping. This industry has been incredibly clever. It's, really driven by clever marketing and ways to tap into our young people and encourage them to take up products. So we do need to continue to be alert and proactive in terms of how we tackle it. But what we've heard about today is a great start. Of course, we have to see them actually upheld in practice in our community for us to see any benefits.
What advice would you have for parents? What's the most effective way to talk to your kids about this kind of thing?
I would definitely tell parents to have a chat to their children and young people about vaping. Start by asking your kids, have you seen other kids vaping? Are these things you've seen around at school? Have you seen other people try them? Have you thought about trying them yourself? Have you perhaps tried this? So just building up that conversation to a point where you then ask them, what about you? But also to make sure they're aware of the risks, because in many cases they're not. They think these things are harmless, they're a bit of fun, but in fact we know, particularly because of the doses of nicotine, they are a real risk to our children and their developing brains, and they're very much at risk of setting up a pattern of addiction, which means it can become much more serious going forward.
Dr. Rhodes, thank you for your insights tonight.
Thank you.
I feel like when vaping first started, I'm going to sound like an old woman, but I feel like when it first started, it was like, oh, well, there's no tobacco in it, so it's fine.
Yeah.
And I know there are some that have nicotine in it, there's some that don't. It's a bit confusing, and I think that the risks of it, it's hard to kind of advise kids because we just don't really know what's in them.
I would admit that until this has become more of a story in recent weeks, I've always assumed when you see a young person doing it, that it is tobacco-free, but clearly that's not necessarily the case.
Well, I dismiss it as well because I really do not like cigarette smoke. I hate the smell of it anywhere near me. But then with vapes, I find it far more accessible. It's much easier, but then I'm still inhaling secondhand smoke, right?
Are you not finding the vape smell starting to irritate you?
Nah, but I'm like a 6-year-old at heart. I'm like, ooh, lolly.
So much vape smoke that it's changing the
humidity. That's what's caused La Nina.
Not sure about the science behind that claim.